It has been found that more than 20% of adolescents will experience depression by the time that they become adults. However, less than 36% of people with depression seek treatment. Because of this, many individuals have found ways to cope by themselves to reduce their depressive symptoms. There are many ways in which individuals cope with depressive symptoms in order to not let these feelings have as strong as an effect as they typically would. One of these mechanisms being humor. Humor has recently become a more prevalent coping mechanism for those who are experiencing depressive symptoms and anxiety, as it allows them to ease some of the severity of the feelings that they are experiencing. It has been found that about 9.6% of individuals use humor as a coping mechanism in comparison to other coping mechanisms.
A study conducted by Thorson et al. Actually found that there is a negative relationship between humor and depressive symptoms, meaning that as humor increases, depressive symptoms decrease. Also, those with a higher sense of humor are less likely to use escape as a coping mechanism, meaning that they are more likely to problem solve, seek support, and are less avoidant with their problems. These relationships allow for further research on successfully using humor as a coping mechanism for depressive symptoms.
A different study conducted by Freiheit et al. Found that humor and depression are reliably related constructs to one another, as results indicated that using humor to cope with emotional difficulties was related to depression more so than the relation between using humor as a coping mechanism and the ability to appreciate or create humorous material in high school students. Because of this, we can infer that when individuals utilize humor as a coping mechanism, it is highly viable that they are doing so to cope with their depression and depressive symptoms.
In a study conducted by Galloway and Cropley, they found that humor as a response is associated with a reduction in some existing mental health problems, allowing the individual to not take as much severity into the issue, making it easier to process the situation. Further, they found that humor as a psychological process appears to moderate the perceived intensity of negative life events. The reason is that laughter tends to bring about tension reduction, and when exposed to laughter, the human body exhibits sensations of relaxation. Freiheit et al. Found that using humor to cope with stressful situations also may be associated with an internal locus of control, meaning that those who cope with humor may feel that they are responsible for their own outcome.
A study conducted by Cooper et al. Found that higher levels of coping humor was positively correlated with the feeling of having more control in one's own lives, as well as feeling less overwhelmed and anxious and less stressed than those individuals scoring lower on the coping humor scale. The results of this study suggest that the individuals with a greater sense of humor appraise and cope with this stressful event in a manner that is both event enhancing and also self-protective. Also, greater levels of humor also function to enhance positive life experiences by leading to higher levels of positive affect. For low humor individuals, however, it appears that they are unable to benefit from an increasing number of pleasant events with greater levels of positive affect. As for low levels of humor, individuals appear to emphasize the personal importance of poor performance and de emphasize the personal importance of unexpectedly good performance.
A downside to using humor as a coping mechanism is that it only alleviates feelings of negativity temporarily. A study conducted by Overholser shows that symptoms of depression, low self-esteem, and higher loneliness levels return to baseline measurements after 7 weeks of the intervention. Further, Overholser writes that an overuse of humor as a coping mechanism may lead the patient to use humor as a form of denial, as it can be used to avoid dealing with problems. This correlates with results found in Karamina and White, as their studies cite that humor is not a permanent solution. It just alleviates stress and depression temporarily.
Another setback of using humor as a coping mechanism is that it is completely dependent on the type of humor that the patient finds funny. Sapper suggests that the effectiveness of humor application in psychiatric care and treatment is completely dependent on the patient's personality. Further, they mentioned that it is not known what kinds of humor are the most effective for treatment or the most versatile types of humor that are effective with different personalities, which makes it much more difficult to use as a viable treatment strategy. However, humor in some form, and when used very carefully, can be effective as it may be useful in the treatment of depressed patients, whether to release the patient's tensions, to give some insight, or as an integral form of therapy. Danzer et al. Study suggests that humor manages to reduce experimentally induced depression, reason being that humor induces zygomatic muscle activity, also known as smiling. This happens more frequently in the humor treatment than any other treatment that they tested in that study.
All in all, humor as a coping mechanism for depression and depressive symptoms can be very effective depending on the individual that is using it. Despite the consequences of becoming dependent on this method and only the temporary alleviation of depressive feelings, the overall use of humor as a coping mechanism can be beneficial, as gaining the ability to cope with stressful life events in a healthier manner, reduce mental health problems, alleviate feelings of negativity, and increase positive feelings of oneself all outweigh the negatives. Moving forward, if the personality of the patient is known, humor can be a positive and effective strategy in treating depression.